Happy Thursday, everyone. This is Ashland KY Chiropractor Dr. Gary Dillon, and once again, it's time for our weekly video health tip. This week's video health tip, I kind of decided to do this just yesterday. I got a call from a very dear friend and found out that her husband has severe Alzheimer's disease. He was a patient of mine years ago, and I hadn't seen them in a while, and I did not know this, and she had seen one of our other YouTube videos and was calling to ask some questions and see if there's anything that could be done supplement-wise to help her husband. So after talking to her yesterday, I decided to do this video on Alzheimer's disease because this is a disease that really affects a lot of people. I myself lost my grandmother in 2008 to Alzheimer's, and one thing that's different with Alzheimer's than a lot of other diseases is a lot of times it's really harder on the family of the person that has it than necessarily the person that has it. Alzheimer's disease and senile dementia are sometimes used synonymously. Very similar symptoms. They are not necessarily the same thing. Senile dementia always comes on in the elderly. Alzheimer's disease can start as early as the 40s or 50s with small changes and get worse as the patient ages. There's a lot of things people need to know about Alzheimer's. They're doing a lot of studying on it now, a lot of research, and that's a good thing. But there's some promising things that you can do for Alzheimer's patients. Now, one thing I want to make clear is this is a progressive disease, and it really affects the memory of the patient. It's really a problem for family and loved ones taking care of the patient. And this is a disease where you need to make a cumulative effort as far as treatment goes. And by that, what I mean is you want to do a lot of different treatments at the same time to help an Alzheimer's patient versus just trying one thing and go, oh, we tried this one thing, it didn't seem to work. You need to really nourish the whole person or the whole patient. A few things you need to know. According to research or other evidence, lots of vitamin E. Now, Alzheimer's patients need to be taking around 2,000 IUs, that's international units of vitamin E each and every day. Try ginkgo for improved memory and enhanced quality of life. You need to take 120 to 240 milligrams a day, depending on body weight, of the standardized herbal extract of ginkgo biloba. Now, standardized is very important. Some of the lesser quality companies do not standardize their supplements, meaning if you take a capsule and the bottle says it's 120 milligrams, well, that's an average in the bottle. You may get 10 milligrams in one tablet and 240 in another. A standardized herbal extract makes sure every tablet has exactly the amount of milligrams or international units, whatever the measurement is they're using in each and every tablet, so you can be assured that you're getting the correct dosage anytime you take these tablets. You need to add acetylcholine, and that is you need to take about 1,500 milligrams a day. That is an amino acid, and it improves memory and slows progression of Alzheimer's. Now, on my doctor's resource on my website, we've got this great article, and if you're watching this on YouTube, of course, hit the subscribe button for us. If you're looking at this on Facebook, hit the like button for me. Go to my website. It's www.dillonchiropractic.com, and enter your name and email address when you're prompted. But you can also go into the doctor's resource guide right there on the first page of my website, and it's got all of this. If you're watching the video elsewhere, I'm going to have the link to this article and this information in the extra information that comes along with the video. But it's got a whole list of supplements that a patient can take, an Alzheimer's patient can take. It's got how they should eat right, what they should be eating, what they should not be eating, about the disease itself, and it's even got dosages. Now, one thing I want to caution everyone about very, very carefully. A lot of these Alzheimer's patients are elderly and they're on other medications, not only for Alzheimer's, but for other problems that they're having as well. So anytime you're using supplements, make sure you check and there's no interactions between supplements or medications that the patient is already on and the ones that you're wanting to use to help with Alzheimer's disease. Now that is also on my doctor's resource. You can go in and check any food, any drug, any herbal drug, any supplement drug, any interaction, so you can get accurate information and make sure this stuff is safe for you to take. I encourage you to go in and look at this Alzheimer's disease information. And once again, as always, if anybody has any questions about this, because I know this disease is affecting a lot of people, and I'm starting to get a lot of questions about it because a lot of people are going through the same thing that I and my family went through with our loved one that had it. If you need anything at all, call my office. It's Dillon Chiropractic, 606-929-9667. My staff or I, either one, will be more than happy to talk to you and give you all the information and help that we can. And like I said, go to the website, go to the doctor's resource, and look up this information. The link will be provided. Again, this is Dr. Gary Dillon, and I look forward to next week when I bring you another video helping you and your family be as healthy as they can be.